Health campaigners in Gloucestershire are celebrating tonight after stopping part of the NHS from being privatised. Today, the Primary Care Trust announced that its community services are to stay within the NHS. That follows a legal challenge against the original plan last year. Here's our Gloucestershire reporter, Steve Nibbs.
Who's NHS?
There have been demos and even a High Court challenge by a pensioner, 76-year-old Michael Lloyd, who is back today to claim victory again.
Traipsing up to London and to the Strand and all that kind of thing, the outcome has been very well worthwhile.
Last year, the PCT wanted its services run by a social enterprise trust outside of the health service. It prompted the High Court case which claimed services should have been offered to the NHS. The PCT backed down, renegotiated, and after an overwhelming staff and public consultation in favour, the board today voted that services should stay within the NHS.
It's what the people of Gloucestershire wanted as well. That was overwhelmingly made clear in the public consultation. 96% voted for that. So we're very grateful to the support we've had from people who've marched, who filled in those consultations.
So how will the new plan work? Well, the PCT is being wound up and a new NHS Trust will be set up to supply community hospitals and health services. Those services will then be bought for patients by a group of GPs running the Gloucestershire Clinical Commissioning Group.
We're going to have to look at doing things differently and empowering patients and people and communities to look after themselves, but for us to be there at the right and appropriate time so they have the right care at the right time by the right person.
The legal delays may have cost the taxpayer tens of thousands of pounds, but it seems that this deal is now better and one which is legally sound.
The length of time it's taken us to respond and the amount of extra advice that we've taken in legal terms to make sure that this is a solid result, not to be overturned, I think has made the decision very beneficial.
The plan to set up the new trust is good news for the 3,000 NHS Gloucestershire staff who have been faced with months of uncertainty, but there is still a caveat that the application to set up the trust may not be successful, and it could mean that places like the Vale Community Hospital could still be handed over to the private sector. So this whole transition is going to be watched very closely by the campaigners. Steve Nibbs, BBC Points West, Dursley.
Well, our health correspondent Matthew Hill is here to tell us a little bit more. Matthew, what is the significance of today's decision for the rest of the NHS in the West?
Well, certainly significant locally because there were a lot of staff who were very worried about moving to a social enterprise trust because of the risk attached to that if it were to fail, that they could be taken over along with their paying conditions and pension by a private company, and that could be threatened. But yet nationally everyone's been watching this, and the unions as well as employers. They were one of the first social enterprise trusts announced in the country, and here we've had very interesting tactics from a pensioner who couldn't afford a legal challenge, got legal aid, so no doubt we'll be seeing other challenges around the country using similar tactics to this. There was an awful lot of uncertainty, that's why many staff were leaving in their droves, which is why the apparent certainty now will be welcomed by both the employers there as well as the staff.
Is it a certainty, though? Is there any chance this could be reversed?
Well, as Steve said, that we have this final hurdle for foundation status, which they should get. But you know, if they don't, then of course it could all be up again for a decision even to go to a private company. But they should be able to get their act together in time.
OK, Matthew, thanks very much indeed for coming in.